Trying to diagnose if someone's having a STEMI, if they're in a left bundle branch block or in a paced rhythm, is very challenging. I don't know whether you've ever looked at a left bundle branch block and gone, oh, they're having a STEMI, and they're actually just not having a STEMI. Or if they're in a paced rhythm, you go, oh, look, there's ST elevation, where it actually, you show one of someone else and they go, no, that's normal. So what's going on here is that when you have a strange depolarization, you're going to have strange repolarization. And that's why you're going to see ST elevation in patients who have a left bundle branch block. And that is where Sgarbossa comes into it. And now that we have the modified Sgarbossa criteria, we can discuss really what that means. So how's it, guys? Welcome back to my channel. This is That Med Guy. Today we're going to be discussing Sgarbossa criteria, more specifically the modified Sgarbossa criteria. You might be like, well, why is this important? Well, oftentimes we see a patient in left bundle branch block or pace rhythm and we see ST elevation and it actually is just void. So we're going to be discussing how do you diagnose a left bundle branch block, talk about what is the Sgarbossa criteria and how to use it, and then we're going to try and apply it. So how do we diagnose a left bundle branch block? First of all, we need to have a QRS that is longer than 120 milliseconds. So that's 4-12, that's 3 small blocks, wider than 3 small blocks. So we have a wide QRS. I actually have a video on ECGs if you're not quite sure what all the stuff I'm talking about. Rather go there first and come back. So you have a QRS that is broadened, and then you have
a William Marrow.
William Marrow is the way that I remember whether it's a left bundle branch block or a right bundle branch block. So if you look at the word William, you'll see a W and you'll see 2 L's and an M. So what this means is, I know this may seem really confusing, but the W is going down and the M at the end of William is going up, and in the middle is 2 L's. So this is for a left bundle branch block. What it's saying is that if in V1 we have a negative QRS that goes down, like a William, like a W, and in V6 we have a positive, or V5 or V6 we have a positive QRS, so it's above, we then have a left bundle branch. And if you have a marrow, the M, so we have a positive V1 QRS, and in V6 we have a negative, which is like the W, the William Marrow, a negative QRS in V6, like this, we have a right bundle branch block. This is just a little trick I've learned. So this would be an example of a left bundle branch block. You see how in V1 it is it's negative QRS, and in V6 we have a positive, it's a M, William, we have a left bundle branch block. So that's how I would diagnose a left bundle branch block. It is important to work out if it's a new block or if it's an old block. Where a modified Sgarbossa criteria comes into is that we need to be able to diagnose whether the ST segment that we're seeing is normal or abnormal. So this would be a ECG of someone in a left bundle branch block, and if you look at this, we have ST segment elevation. But it's absolutely normal because, like we said, we have abnormal depolarization, we have abnormal repolarization. So this is something that we can expect. Criteria 1, so there's 3 criteria of the Sgarbossa criteria. The first one would be is that you have 1 millimeter of ST elevation with QRS concordance, which means that if the QRS is positive and you have a more than 1 millimeter of ST segment elevation in more than one lead, that is enough to say that there is ST elevation. So what is important to look at is that in a normal bundle branch block, or sorry, a left bundle branch block, you're going to see something like this. You see where the QRS is down and the ST segment is up, that's pretty normal. But if you have concordance, meaning it's together, where your QRS is positive, so it's moving up, and your ST segment is up, that is concordance. But if you have discordance, it means that your QRS is down and your ST segment is up. That's absolutely normal. So the first criteria is when your QRS is positive and you have ST segment of more than 1 millimeter in more than one lead. That's significant. The second criteria for the modified Sgarbossa criteria is to have concordant ST depression of more than 1 millimeter in more than one lead between V1 and V3. So that's a positive QRS with ST depression of more than 1 millimeter in leads 1, 2, or 3. This is also significant. So if someone has that, going to say to you they're having a STEMI. So positive QRS ST depression of more than 1 millimeter in more than one lead, specifically V1, V2, and V3. Your third criteria for your Sgarbossa criteria is that you have discordant, meaning that your QRS can be negative and you have ST elevation of more than 1 millimeter in more than one lead that is at least greater than 25% of the size of the S wave. Just the Sgarbossa criteria, before it was modified, said that you needed to have more than 5 millimeters of ST elevation if it was discordant, meaning it's a negative QRS and a positive ST segment elevation. But what they're saying is that actually they would be missing patients who are having STEMIs because it wasn't very specific, it was more sensitive. So when it wasn't really there, it was more of a problem. And so now they're saying that it is actually all depends on how big the it all depends on how big the S wave is. So your pretty much in like the most laid term that I can find is that your ST segment elevation needs to be big enough in proportion to your S wave. So if your S wave is massive, your ST segment has to be massive. And so it needs to be at least 25% of the size of your S wave. So you have your QRS. So you look at the size of your S wave and then you look at your size of your ST elevation. And if it's 25% of your depth, because it will be negative because it's discordant, the QRS is going down and your ST segment is going up. If it is at least 25% of your S wave, then you have a positive ST segment elevation. The third criteria for your modified Sgarbossa criteria is that you have discordant, so your QRS is negative and you have ST elevation of greater than 1 millimeter in more than one lead, which is at least 25% the size of the preceding S wave. So you look at the previous S wave and you say, is my QRS at least 25% the size of that S wave? Is my ST segment elevation at least 25% the size of the previous S wave? Sgarbossa criteria, before the modified Sgarbossa criteria, said that your ST segment would need to be 5 millimeters. Now they're saying that actually, because we can have massive currents moving through these left bundle branch blocks, you are actually wanting to make sure that it is in proportion to. If you have very small S waves, you might actually get away with maybe 1 or 2 millimeters of ST elevation. But if you have a huge S wave, you're going to need a much bigger ST segment elevation. And so that's pretty much how your third criteria is going to work. So if you look at this ECG here, you'll see that we have concordant ST segment elevation, which means that we can say we have a STEMI. In this ECG here, you can see that we have ST depression in V123. That's also positive STEMI. And then you see here, we have a massive S wave and we have huge ST elevation. And once again, that will be considered STEMI. So guys, I hope you enjoyed this. If you have any comments or questions or any times where you have had to use or wish you had known about the Sgarbossa criteria, please drop a link in the bottom drop a comment in the bottom. And guys, thank you for your time. Stay safe, stay sound, and bye for now.